Welcome back to the Morning Blend, where we're transforming your health with Wheaton Franciscan Medical Group, part of Ascension. More and more young people are playing team sports, and along with that, reports of concussions are on the rise.
Today, what parents, athletes, and coaches need to know so you can avoid long-lasting consequences. Dr. Erin O'Tool is a primary and specialty care family medical physician. He's here with more on diagnosing and treating concussions.
Morning.
Good to have you here,
Morning.
Doctor.
Thanks for having us.
Yeah, I think this is a hot topic. People want to know all about concussions. How do you tell people you define a concussion or tell if somebody's had one?
Sure, it's difficult. So I think the things to look out for are, concussion in general, as a definition, it's a jolt or blow or hit to the head or to the body that causes.
Yeah, see, I didn't know that. I don't mean to interrupt you,
okay.
but that your body can take some sort of blow, not your head necessarily, and you can have a concussion as a result.
Yeah, historically, I think we've thought of it has to be hit to the head and you have to lose consciousness, but neither of those two things necessarily have to happen to get the injury. And so that blow or hit to the head or body causes a kind of a temporary change in the function of the neurons in the brain. And then that change in the function of those neurons results in kind of the symptoms that we often see people experience.
Well, and talk through some of those. I mean, I told you one of the things after I had a car accident, I had a concussion. I had a lot of problem with sound. Any sound was very, very irritating. I know a lot of people have light issues. Yeah.
So the most common ones are dizziness, kind of a cognitive fog, and headache. And then after that are typically things like sensitivity to light, sensitivity to sound, some vision changes, sleep disturbance, some emotionality changes. So like people more upset or more tearful. Those things are all kind of depends on the person, obviously.
Well, one thing real quick, a lot of times people hear if you get a concussion or you think you do, don't go to sleep right away. Is that still true?
Nope, that's kind of old wives' tale. The concern for people going to sleep after a head injury is mostly concern about a bleed on the brain.
Gotcha.
Those typically happen with much more severe trauma.
Gotcha.
And what's interesting is that you should look at symptoms immediately. So you've got a kid on the sidelines of a sport, or you're in a car accident or some other type of injury. You look for certain things right away, and then you look over the next 24 to 72 hours. The thing that's always been unclear to me is, can you conclusively tell whether or not with some type of scan or testing that someone has actually had a concussion and to what degree the injury is?
Yeah, no, really good question. I think people bring this to doctors' attentions or ER's attentions all the time is, can I get a scan of my brain? Does it tell me if I had an injury or not? And that's not really the case at present time. And it's really kind of the way I couch it from the patients that see me is that it's kind of like putting a puzzle together. Like you've got lots of little pieces. You have the mechanism of injury, you have symptoms, you have the evaluation by the doctor in the ER in your office.
And is that a balance test?
Some of it can be, yeah. So that's kind of one component of the testing. And so you put all these puzzle pieces together and that kind of paints a picture. And usually when they're seeing me, it's usually the picture is pretty clear, but not always the case in the ER because not all headaches after an injury mean you have a concussion. It just is a possible sign.
Is the issue here that there's not a baseline of what your brain looked like before the injury?
Maybe. That's a really active area of research right now, is kind of trying to figure out what people's function and what their brains look like at baseline before an injury happens, and then kind of how the brain looks afterwards. Nothing real clear that's kind of ready for prime time for patients, but I think we do a lot of this baseline testing now as a way to maybe get a sense of what's happening with the brain before an injury so that we can compare that information to what happens after.
Is that something a parent would ask for before their child begins in a sport?
Yeah, so depending on what school they go to, if we're talking about school-age kids playing sports, some schools will offer it. You can also ask your primary care doctor or sports medicine physician if there's any baseline testing that's available. It's a kind of a hot topic in the concussion subworld, right? Whether or not how good those baseline testings are, but I think it does give people a sense of what's going on before the injury.
Yeah.
But a lot of the symptoms you mentioned, and you mentioned a lot of them, but I've seen, and I think it's really important to know what to kind of look for. If you're on the sidelines of something or someone's been injured in some type of accident, people moving clumsily, seeming off balance, answering questions really slowly. I've seen that. Mood and behavior changes, and some are kind of right away, and some aren't until later.
Yeah.
How long can a concussion last, and what should you do if you suspect your child has a concussion? Should you be going to the doctor or the ER?
So I kind of think of it out in two ways, right? There's kind of this acute phase right after a possible injury, right? So kind of maybe on the field, parents and coaches should be looking out for certain symptoms, change in behavior and how the person is playing, acting clumsy, like you said, just not playing normally. Or if they're reporting any symptoms to you directly, obviously. And then over the next kind of 72 hours, parents need to be on the lookout, and coaching staffs too, on the lookout for any development of other symptoms like we talked about, headache, dizziness.
Vomiting too.
Yeah, so yes, repetitive vomiting can be a sign of something more severe, but yeah, some nausea can go along with it also. And then kind of over the long term, we talk about kind of how to, or when or who to see for these types of injuries. And I really suggest that people go see their primary care doctor. Evidence suggests about 8% people do that anyways. But then your primary care doctor can kind of steer you in a direction, because if you're not getting well quickly, then you probably need to see somebody else.
How long can the symptoms last and persist, and what do you need to know about that?
So generally speaking, it's like 60 to 70% of people are going to resolve within about 14 days.
Okay. 2 weeks.
Yeah, but 90% by about a month. But then there's kind of this protracted group of people that are about the last 10% that kind of lasts so much longer. We can kind of say up to about a year. And so those people are in rough shape, and kind of need kind of subspecialty care. And
if they have a second concussion before the first one is completely healed, that can be a risk for long-term problems, right? Yes. So this concern for second impact syndrome, all right, it's very, very rare, but is very serious. So unfortunately, a couple of athletes every year die from essentially not reporting an injury and then having a second injury while their brain's still recovering, and that can result in coma and death and all kinds of long-term consequences otherwise.
I think the best thing to do is meet with a doctor, get the information. You can visit a doctor with Wheaton Franciscan at mywheaton.org/find a doctor. There's a Concussion Care Network there. That at mywheaton.org/concussion, you can learn more. The hotline is 414-325-6251 to meet with a specialist there. Thanks so much for being here.
Thanks for having me.
Really good information. Thank you.